afternoon, Marianne. Thank you for coming back to the hospital. I've turned off my phone and told my receptionist not to disturb us, so you will have my complete and undivided attention.
Thank you, Doctor.
Okay, right away in this interview, we see that the doctor has made Marianne, the patient, aware of the fact that he has instructed his staff to not disturb them during their session. Did you notice that?
Yes, I did notice that. I also noticed that he made sure his phone was turned off and that all other distractions were removed from the scenario.
Absolutely correct. Now, one of the things I wanted to point out, though, was he could have turned off all of his phones and asked the secretary or the front desk not to disturb him, and he didn't really have to tell the patient. However, by telling the patient this information at the beginning, he's allowing the patient to understand that she is his main priority at this moment. And so once again, he's fulfilling that super critical priority of establishing rapport with the patient, particularly in this situation when the trust of the patient and this balance is so very important, I think.
Exactly, yes. In this moment, he certainly is demonstrating to the patient that they're his number one priority at this moment.
That's right. All right, let's look at some more.
How have you been since I last saw you?
Honestly, not so good. The pain just seems to be getting worse, and it's a lot more consistent. And I mean, quite frankly, the painkillers that you gave me they don't really seem to be making much of a difference.
I'm very sorry to hear that. I'll prescribe you some stronger medications.
Thank you, Doctor.
Okay, there's a couple things I want to point out in this particular scene. This is between S and P of the spikes protocol, where S is setting, and we saw that he demonstrated that there are no distractions, they're in the proper setting. And P, of course, we now know is perception. But before he asks the patient what she thinks is going on, he asks her, "How have you been so far since I last saw you?" To me, that really works because whenever you have this kind of interview process, you're not a robot reading off a set of checklists, right? Your job is to establish rapport with the patient again, as we mentioned earlier, and to create as much as possible this sort of organic interaction. And I think by asking her that question, "How have you been so far?" he allows that process to happen.
Oh yes, I totally agree. At this point, he's doing his best to build a relationship with his patient. This type of step up is necessary before you move on to the more difficult conversation that's about to come.
That's right. And there's one more thing we notice. He's using active listening skills. Did you notice that?
Yes, yeah, he was facing the patient, making eye contact as best as possible, and listening to the patient as closely as possible.
That's right. Now, hopefully, in the future, we're going to make a video about active listening so that our audience can learn how to do that.
It has been a few weeks since I last saw you. What do you suspect is going on with these headaches?
Honestly, I don't know. I mean, I took your advice. I reduced the amount of caffeine that I intake, and I've also been trying to sleep more and on a regular sleep schedule, but it just doesn't seem to be making any difference. I mean, I'm starting to suspect that my worst fears are coming true about a brain tumor, but I think I'm just being silly. I mean, brain tumors are really rare, right, Doctor?
You're right. Brain tumors are rare.
Okay, so in this particular section, there was something interesting that happened to me. She began to suspect what we all know is coming, that she has a brain tumor. However, when she directly confronts the doctor, he doesn't break character. He confirms her statement, brain tumors are rare, but still he allows the spikes process to continue. And I think that was really well done.
Yes, yeah, I agree. Again, this whole little bit of the conversation was very good about testing the patient's perception of their current disease state. And so obviously this patient is concerned, and they're actually growing. Their concern is actually growing. And this is a good chance now to segue into the next step of the spikes process.
That's right.
Today, I'd like to talk to you about the results of your MRI. Before I do, would you like for me to tell you the results now? Or would you prefer to have a family member present?
Now, now you're scaring me, doctor. I don't know what I'd do if I'm not strong enough to handle this on, you know, my husband is out in the waiting room back there. Do you mind if I just go get him real quick and bring him in? Is that okay?
Not at all. Please do that.
Great, thank you. I'll be right back.
So now we've made it on, as you can see, to step 3, I, or invitation. At this moment, the doctor had a chance to ask the patient if they're ready to hear the information that they're about to share. But it gives this patient an opportunity to make a decision for themselves whether or not they're ready to hear this information right now, or whether or not they'll need somebody else present before they hear it.
Absolutely. There's one more thing that happens here, I noticed, and that is, as soon as he said, would you like to have someone here with you? Right away she knew, oh my goodness, the news is not going to be good. He's allowed the patient to brace herself for this information, and just as you mentioned, have the opportunity to have that moral support there with her if she needed it. And she does need it. She's gone to get her husband.
Right, yes. In the case of bad news, having a good support group can be very important.
Absolutely.
Mr. Smith, I'm Dr. Saito. Nice to meet you.
And you, doctor. Thank you. Please call me David.
Okay.
Now, what seems to be the problem? The diagnosis must be somewhat serious, otherwise you wouldn't have invited me in here.
I'm afraid you're right. I don't have good news for you today. The results of your MRI came back, and they show that you do indeed have a tumor in the front part of your brain.
Are you sure, doctor?
Unfortunately, the test was conclusive. There is a tumor.
I don't know. No, I don't want it. No. This can't be happening.
So we've made our way into step 4 of the Spikes protocol, knowledge. As you can see here, we're given our first chance to actually share the diagnosis with the patient. What you also might have seen was that the doctor did not use any medical jargon. They tried to actually use plain, simple English to explain this process or this problem to the patient. They were also very direct. It's safer in this case to be direct and honest about the patient's diagnosis than to try to dance around the subject.
One very great thing you said about the fact that the doctor used plain, simple English. Remember, one of our objectives for making this video series is to help second language learners get language they can use for an interview. And one of the things I've noticed over the years is that people tend to freeze because they're worried about their language ability. However, as we can see in this interview, simple, clear, plain language is all you really need in order to be able to handle yourself in a situation like this.
Yes, that's absolutely right. The patient did not study medical knowledge or medical terminology like you have, and if you are to use any of that more complicated language, that will just simply go over their head and they won't be able to understand it.
That's right. And if you are not confident in your English, more powerful than your words is your attitude towards the patient. So if you speak in broken English or make a grammatical mistake, the patient will not stop and go, oh my God, you used the wrong subject in this part of the sentence. But if your attitude is not correct, that's when you're going to start to have problems.
Here's some tissues. Take all the time you need.
I have to pause the video once and criticize our actor here. We can see his facial expression doesn't quite match the mood of the room. Did you notice that?
I did notice that, yes. Obviously, this can be a very awkward and even uncomfortable position for physicians. It's very difficult to give bad news. However, we must always remain professional, and we must always match our facial expression and our tone to the scenario.
Absolutely.
So,
I'm sorry. I thought I could be stronger than this.
I understand that you're scared, and what you're feeling is totally understandable. I can only imagine what you must be going through right now.
I'm not ready to die, Doctor.
There's just one quick thing I want to mention. He said, I can only imagine what you must be going through right now. He did not use the trap that many people fall into of, I completely understand what you're going through right now. I totally get it, or any of those comments, because in reality, it is absolutely impossible for him to really know what the patient is feeling. And by saying, I understand what you're going through, that could also sound patronizing or condescending. So by using the phrase, I can only imagine, he's sort of avoided that trap while showing empathy towards the patient.
That's correct. And he also was doing a very good job of displaying his active listening skills. He was paying attention to the way the patient was acting and what they were saying so that he could reflect back to them the things he's seeing. As he pointed out, the patient looked scared, they looked nervous. And he also said it's a quite normal thing to happen under this case. This shows a little bit more reassurance. It's an understanding of the way the patient feels. And it can help in situations such as this.
At this point, we don't know if the tumor is benign or malignant.
What do you know, Doctor?
Well, based on the MRI scans, we can see that the tumor is in the front part of the brain, and it is about 3 centimeters large.
3 centimeters. Is that big?
It is big enough to start causing some of the symptoms that Marianne has been having. I promise you both we will do our best to treat this.
Okay, another thing I noticed was the fact that he's giving them clear answers. He's not dodging any questions. It's easy to understand. And all the way through the process, he remembers to try and reassure the patient that they will do their best, not to cure them or miraculously heal them of cancer, but to help them through the process.
And you may have also noticed that he again continues to use simple English to explain this. When he's talking about the location, he simply says it's in the front of the brain. We've got plenty of medical terms that could be used to describe this, but he needs to be staying within the world of language they understand, and that's why this simple explanation is the best way to share this information.
How long do I have to live?
Well, at this point, it really is too early to tell what the prognosis is. We need to do a few more scans and a biopsy to determine what we're dealing with. I will refer you to Dr. Hattori. He's the head of the neurology department. He will oversee your case to make sure that you get the best possible care. He will also do a neurological exam to test your reflexes, hearing, eyesight, and other things that can give us more information about how the tumor is affecting you.
In this section, we not only have the doctor sharing his knowledge about the disease, but he's also making the patient very aware of what's going to happen next, making each step clear so that they don't have to worry about what to do next. And did you notice when he mentioned Dr. Hattori, who at the time of making this video is actually the Dean of Medicine at Juntendo University and also a neurologist, did you notice that he didn't say, we're going to have our best doctors look after you? He named the doctor, named the credentials, again, in order to communicate this idea that they will be treated well and with respect.
Oh yes, that's correct. We want to continue to add a human element to this. And again, by mentioning people by name, and you may have noticed that every time he speaks to the patient and the patient's spouse, he also mentions their name. He's adding this extra layer of humanity to his interaction with them, which can help build this connection with them and help them through this difficult time.
Now, there's one small bit of critique that I would like to give our good doctor, and that is when there's a family member present, it's actually better to directly address the patient and not answer all questions through the family member. because that can feel dismissive. It can make the patient feel as if they're isolated. That sort of phenomena of, hey, I'm right here in the room, you're talking about me. I think he should split his eye contact between the patient and the husband. And right now it seems as if he's focusing only on the husband.
I completely agree with that.
Once we have a clear idea of what we're dealing with, we can make a plan to get you better.
I remember my grandfather watching him die of a brain tumor, and every day he was just weaker. It was just so pitiful. I don't want to end up like him.
I know that this must be very frightening for you, Marianne. My team and I are here to help you get through this difficult time. Now, it really is too early to say. The tumor may be benign. I can't really be sure until we run some more tests.
So as you can see here, the doctor is also doing his best to avoid saying anything from a very absolute standpoint.
Mm-hmm.
And that's commonly the case in medicine. We don't always know the answer. We don't always know how to solve a problem. So it does take more time and more tests usually to determine the right course of action. So our doctor is doing the right thing here when he is more or less avoiding saying anything that's too direct or too absolute. And he'll couch everything with, at this moment we believe, or we will have to run more tests before we can answer that question. And you should always remember that in your own practice. Try not to give too direct or too absolute responses, because things change rapidly within the medical community.
The other thing I noticed was the way that he responds to them. He does it in a way that gives them hope, but not false hope. For example, he said the tumor may be benign. We need to do more tests to be sure. In that sentence, I felt as if he was saying, please don't worry so much now. Let's wait for the test results. However, he never says to them, please don't worry. That would be the worst thing to say, because if someone tells you that you have a brain tumor, how can anyone on the planet stop you from worrying? That's a ridiculous statement to give to a patient. But by telling them it may be benign, there are treatments for this, the prognosis may still be good, those kinds of statements give the patient hope while avoiding the trap of giving them false hope.
I completely agree.
Well, will she need surgery?
I'm afraid I cannot really answer that until we know more about the nature of the tumor. For right now, I would like to schedule you for another MRI. When is the earliest that you can come in?
I have a brain tumor.
How about Sunday afternoon, if that's okay? I can drive her here.
Thank you, David. Marianne is very lucky to have you by her side.
Notice, again, he's always never forgetting to build that rapport with the patient. He says, thank you, David. He makes a comment of she's lucky to have you by your side. All of these things help to reduce the utter trauma of having to face this idea of living with a brain tumor.
After the MRI results have come back, you will meet with a neurologist who will take care of you from now on. We have a great team of doctors who specialize in the brain. Dr. Hattori or one of his team members will walk you through the next steps. Of course, I will also be here if you need me. You're in good hands here, Marianne.
Thank you, doctor.
Before we wrap up, I just want to make sure that you've understood everything. Could you tell me in your own words what we discussed here today?
I have a brain tumor.
We're gonna get through this, honey. Don't worry. I'm here for you.
David, I'm so sorry to ask you this, but it is important to confirm that you or Marianne have understood everything. Can you tell me in your own words what we have talked about here today?
So what you're seeing here is what we also commonly call the teach-back method. When it comes to providing information to your patient, whether it be good or bad news, it's sometimes difficult for the patient to understand. So we need to gauge their understanding somehow. And what we found is by asking the patient to repeat back to us within their own words what they've heard, it gives us that chance to gauge their understanding. And that's exactly what this doctor did in this situation.
There's also one thing we have to be aware of, and that's the fact that the emotional strain that hearing something like this has on the patient could short circuit their ability to be able to listen to any other words that are coming from the doctor's mouth after hearing you have a brain tumor. And because of that, a lot of important information may be missed by the patient. So by having the patient repeat back instead of the doctor just summarizing, as you rightly mentioned, it allows the doctor to be able to tell how much of the information they got. And we can see in the video that actually the wife was distraught because of the news of her brain tumor, and so the husband was there to sort of pick up the slack and be able to gather all the information that's necessary for them to make their next steps. So we can loop this back to the original I in Spike's invitation for information, where he asks Marianne if she needs some support. She says yes, she brings her husband, and now we can see not just for emotional support, but why the role of having a family member there when the person needs it is so important.
Oh yes, that's absolutely right. There's a physiological explanation for this. When you're in shock, the body immediately starts to shut down other processes, and what you end up getting is tunnel vision, and oftentimes even your hearing will go. So yes, the patient in this case, Marianne, is probably not able to hear much of what this doctor is telling her, and having her husband there is very valuable. But it's also true that this husband is going through a very difficult moment. So it's also quite possible that he's also missing a lot of important information from this interaction. So all the more reason why we need to have this teach-back method, this opportunity for the patient or her spouse to tell us what they've heard.
Well, the MRI identified a brain tumor. It's about 3 centimeters in length. The tests will need to be conducted more to identify how bad it is, and we'll come in on Sunday afternoon for the follow-up examination.
That is right. Do you have any other questions?
Oh, you said you're gonna need to do a biopsy. How is that done exactly?
Well, depending on the results of your MRI, there are several ways to conduct a biopsy. The most common is to collect sample tissues using a needle through the soft tissue. Again, I can't say what approach they will use until we've run and get the results of more tests.
I understand.
Do you have any other questions?
I just think we're too much in shock right now to know how to respond.
Okay. I'll give you my email address. If either of you have any questions or concerns, please do not hesitate to contact me anytime, and I will respond as soon as possible.
Thank you, Doctor.
Thank you, Doctor.
I know this is a difficult time, but we will do our best to help you get through it.
Okay.
Okay? If you don't have any further questions, please return to the waiting room. The nurse will be with you shortly.
Okay, so another thing that I noticed while watching the video was the patient asked about a biopsy, a word that could be quite scary, actually, because a biopsy can be a very invasive procedure. The doctor responded to her by explaining one of the ways they could take the biopsy. I noticed that he chose the least invasive method, not to alarm the patient, but still did not commit to that procedure by saying we need more results before we actually know. So basically what that means is he's answering her questions, he's continuing this objective of providing the patient with hope, but at the same time he's being very real about what the possibilities are and how to move forward. And I thought that was quite effective, actually.
I agree. I think he did a great job.
And then finally, all the way to the end, of course, he's reassuring the patient even to the final words of the interview, reminding them that he's there for them, there to help them get through this moment and doing their best for them. I believe that in a time like this, that reassurance is more important than ever because they're afraid. They are confused, possibly. And so having that reassurance helps to anchor them into this reality of what they have to do moving forward for treatment.
It was also a great idea to mention that they can still reach out to him and contact him after they've left this meeting. He offered them his email address, which is a good way for them to reach out and contact him, because they're certainly going to have plenty of questions. But at this moment, they really are too much in shock to ask those questions. At this moment, they really just need some time to process what they've just been told and potentially even to grieve a little bit. After that, they're going to come back with a lot more questions, and the doctor did a great job by offering his assistance in the future to help answer those questions.
That's right. And you know what's one small thing? Why not a phone number? Why an email address? Why do you think that is? It's so he can control the flow of information and answer the questions that really need to be answered. Because it's quite possible in this distraught state, they could be like, oh, what are we going to do with our cat? Doctor, I need you to tell me now. You know what I mean? But by giving the email address, he can filter out the sort of distraught responses and answer the really important ones.
All right.
Thank you, Doctor.
Thank you, doctor.